Fox 5 Health News, the U.S. Surgeon General declares loneliness a public health epidemic, saying it poses health risks as deadly as smoking up to 15 cigarettes a day.
All right, join us now, Dr. Serge Sugger, Chief of Infectious Disease at Holy Name Hospital. Thanks for being with us here, Doc. And this is really a really staggering statistic, just sort of illustrating for us the connection between mind and body.
Absolutely right, Stephen. And hi, Steve, Natasha. Thanks for having me. You know, I think that's why the Surgeon General, Dr. Vivek Murthy, really issued this statement, really to reveal and kind of pull back the curtain, if you will, and reveal just the scope of this problem. A staggering 50% of American adults that have been polled have said they're experiencing some concern for loneliness. And if you look at that even further, we look at almost 30% increase in death in those experiencing loneliness. That's things from either stroke, heart attacks, increased risk of developing anxiety, depression, and even dementia. So very staggering indeed. And if you look even further at this report, it's the age 15 to 24 that seems to be the most at risk. When I'm looking at preparing for this talk, reviewing the data, it's amazing. 70% decrease in engagement with friends and family in that age group compared to just 2 decades alone. So as you can imagine, this is a massive problem. This is an underreported problem. I think the last couple of years we've talked about mental health, depression, schizophrenia, other things, and it's coming more to the forefront and being less stigmatized. This issue of decreased social connectedness, loneliness, if you will, is really something that I think needs to be discussed further on all aspects of healthcare.
Yeah, for sure.
It's normalizing that conversation. Well, it's also known that dense breast tissue is a risk factor for breast cancer. And now a new study is adding in a twist, potentially linking changes in density over time to breast cancer. So, Doctor, walk us through the study, what they found, and then what this means for women.
Yeah, a very profound study published in the JAMA, so Journal of American Medicine Association, Oncology, specifically out of WashU in St. Louis. And just a little background, we know that dense breasts in general are associated with increased risk for breast cancer. So much so that now the FDA is recommending that healthcare providers and mammography centers, et cetera, let women know that not in addition to any findings they may have, that also let them be aware that they have dense breasts. 30 states and counting are now requiring women to be informed of these dense breast issues. But what hasn't been seen is how the breast density changes over time. And that's what this study is really the first one, 10,000 women over a long period of time. And they found that not only women who had dense breasts at the start of the study had increased risk for cancer downstream, but what we do know is that as women age, the breasts become less dense. But that rate of decline, if its rate of decline is less in those who eventually develop breast cancer. So in other words, we can use different targets of time to help women ascertain their risk of developing breast cancer. Really, we can risk stratify their risk and may even change how often they get mammograms, et cetera. So this is a very profound study. We would like to see a larger study that mimics the findings before we make any long-ranging conclusions. But certainly it would be an added data point that we can inform women and help them to make the best decisions in terms of screening, et cetera. For now, of course, we rely on more standard risk factors, age, genetic and familial risk factors, smoking, obesity, late menopause, et cetera. But again, it's very exciting in terms of another data point and another a tool, if you will, to really help us combat this deadly disease.
Makes sense. All right, Dr. Serge Sugger, we appreciate it. Thanks.
Thanks for having me.